Namaste Bitya, Hamisha Khush Raho A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In today's clinical class, we are going to discuss about the specific symptoms and signs of some important type of anemias. In this table, we can see different type of anemias like iron deficiency anemia, vitamin B12 deficiency anemia, and hemolytic anemia. We are going to discuss about these anemias one by one. In iron deficiency anemia, there is the peripheral blood film shows iron deficiency anemia. The red blood cells are smaller than normal microcytosis, and their central area of pallor is extended hypochromia so that the cells appear to have a rim of hemoglobin. The symptoms consist of glossitis with papillary atrophy, bald tongue. There is angular stomatitis, chelosis, fissuring at angles of the sore tongue. There is dysphagia, that is difficulty in deglutition. It is Peterson and Kelly or Plummer-Vinson syndrome, and koilonychia or platinichia. The cause for iron deficiency anemia is strict vegetarian diet, diarrhea or malabsorption, gastrectomy, chronic blood loss from the uterus, that is menorrhagia, dysfunctional uterine bleeding, GI tract, example NSAIDs, bleeding peptic ulcers, piles, varices, gastritis, colitis, and hookworm disease. Renal, example hematuria, nose epistaxis, lungs hemoptysis. Increased demands, example growing, pregnancy, and lactation. Vitamin B12 deficiency. The figure 18.2b shows macrocytic anemia with megaloblastic bone marrow. Upper peripheral film shows larger RBC with poor hemoglobinization. Lower bone marrow examination shows megaloblasts. It is seen with mild jaundice. The clinical features of vitamin B12 deficiency includes mild jaundice, a lemon yellow tinge on the skin, gray hair, red smooth magenta colored sore tongue, tingling and paresthesias, weight loss, an abnormal gait, skin pigmentation, mental features, example, poor memory, lack of concentration, depression, personality change, and hallucinations. The optic atrophy and subacute combined degeneration. The cause of vitamin B12 deficiency is inadequate dietary intake, that is, strict vegetarian diet, malabsorption, which includes diarrhea, autoimmune gastritis resulting in loss of intrinsic factor, previous surgery like gastrectomy. Third one is the hemolytic anemia. In figure 18.2, hemolytic anemia, upper abnormal shape of the cells, hereditary spherocytosis, and lower abdominal hemoglobin, sickle cell hemoglobins. Symptoms and signs of anemia includes mild jaundice, dark colored urine, and stool, example smoky urine, due to hemoglobinuria or frank bloody or even black water fever. Abnormal facies with frontal glossings, skin induration of legs and gangrenous toes or dactylitis, seen in sickle cell anemia, hepatosplenomegaly, pigmented gallstones, that is biliary colitis. The causes are of hemolytic anemia includes increased demand, pregnancy, poor intake, that is diet lacking green vegetables, infections, hemolytic anemia due to the cause, malabsorption, congenital or hereditary defects like spherocytosis, thalassemia, glucose 6-phosphate dehydrogenase deficiency, drug-induced, that is analgesics, antimalarials, and antibiotics, autoimmune and infections like malaria. The next one is the hypoplastic or aplastic anemia. The figure shows hypoplastic anemia with bone marrow examination reveals just fat and fibrosis with no clear element. There is neutropenia results in infections, neurotic mouth ulcerations, and throat ulcers. There is thrombocytopenia, which results in bleeding on the skin, mucous membrane, epistaxis, hematuria, or intracranial bleeding. The symptoms and signs of anemia. The cause is irradiation, the drugs, chemical, infections, and autoimmune diseases. So these are the different type of anemias. First of all, iron deficiency anemia, vitamin B12 deficiency anemia, hemolytic anemia, and hypoplastic or aplastic anemia. So this was all about the different type of anemias. In the next lecture, we are going to discuss about blood differentiation between acute and chronic leukemia. This section is powered by Digital Version 2.0 Jyoti Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. This was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.